Hi everyone, welcome. This is Dr. Nikravan Clinical Consult Series. Today's topic is diabetes, and I wanted to share a quite interesting case with you guys to explain the validity of average blood sugar versus a more close follow-up and surveillance. A delightful patient presented to the practice today regarding symptoms of hot sweats, night sweats, dizziness, fatigue, and her doctor told her most likely it's related to her postmenopausal symptoms. The patient became quite concerned because these symptoms actually occurred about 10 years ago when she was around 50. She couldn't figure out why these were happening again. So they did labs and diagnostic data which showed everything to be essentially normal. And when she came to us, her hemoglobin A1C, which is an average 3-month blood sugar measurement, was 5.88%. That's a great number. If you can be a diabetic to have a hemoglobin A1C of under 6%, that's great, unless you're having low blood sugar. So I start to think what's going on with this case, and I did the further workup, which I'm about to present to you. So as you can see, we installed the continuous glucose monitor on this patient, and this lady unfortunately was suffering her low blood sugars as I expected, even though her blood sugar A1C was 5.8, which is a great number, and it's an ideal number to get all diabetics to as long as they don't have low blood sugar. As you can see right here, this patient, 70 blood sugar, if you look here, 41% of the time, her blood sugar was below 70, in which 54 milligram per deciliter is the critical low, and 26% of the time, that means a quarter of those numbers were less than 54. That's a 911 call, emergency. And this poor lady was told that she's most likely having some hot flushes-like symptoms. Only 53%. So this goes to show you that the hemoglobin A1C is a false indicator of blood sugar, because if you have a lot of highs and a lot of lows, you'll get a medium number. In this case here, her A1C was 5.8%. It was perfect, but her blood sugars were absolutely abnormal, indicating that she had a lot of low blood sugars. And as you can see right here, throughout the day, she's having a lot of low blood sugars. All these red zones are indicating low blood sugars here, 63, look right here. And these are numbers consistently low, and she would have to eat to compensate for the low. And you can see all these red zones are consistently low blood sugars and patterns that we see right here. So this is absolutely horrendous for this patient to suffer for low blood sugars consistently, and something that can be avoided. So what we did immediately, we made changes to her diabetic drugs and diabetic medicines, and I anticipate that her low blood sugar symptoms will drastically change quite quickly. As you can see that she has a lot of numbers below 70, which even go 50, if not 40 right here, based on the patterns that are seen right here. And these are all dangerous because low blood sugars are the worst thing that any patient can have. It could induce them to have dizziness, lightheadedness, and typically we see these patients passing out, falling down, and if they live alone by themselves, it is quite dangerous because they can go into a hypoglycemic coma. Therefore, when we choose diabetic drugs, we choose drugs that do not cause hypoglycemia because a lot of great drugs are available to us. So at this point here, this is a really good case I wanted to share with you. And the point takeaway is that the hemoglobin A1C, which is the average blood sugar that your doctor may look at, is an incomplete picture. It is only valid if your numbers are all low, all high, or all stable. It's not very good when you have high and low, as you don't want to average a lot of A students or a lot of F students together, because you'll get a false average of the class, and it's not fair to the A students, or it doesn't justify the F students and their grades accordingly. This is very important. I hope this has been educational for you. The patient is very happy. She walked away. We've got good answers. She's going to get a follow-up in 2 weeks. We put another continuous monitor on her so she can walk away, feel comfortable, and she was very happy. And I was really excited to share the results with you. I hope there's been any questions. I'm happy to answer for you, so please let me know. Thank you so much.